Good morning, everyone. My name is Cassie Chambers, the Operations Director at the South African Depression and Anxiety Group. I'd like to welcome you this morning from wherever you are joining us in the world to our webinar for World Mental Health Day, Mental Health in an Unequal World. I really look forward to engaging with everyone and having this discussion with our esteemed speakers this morning. So thank you again to everyone for joining and for the wonderful speakers for their time today as we unpack this very important and relevant topic, especially in South Africa right now. I just wanted to see and say hi to everyone who is joining us. You're welcome to post in the chat box where you are joining us from this morning. It's always really great in our new online world to connect and engage. I'm going to just start off with just sharing some of the insights from SADAG's perspective and kind of set the frame for today. When we're looking at mental health, it's so important to have people's voices. And as we begin, I'd really love to hear from everyone that is joining us today. And we have people from around the world, as I'd mentioned, but we also have, heads of departments, government officials, social workers, psychologists, psychiatrists, counselors, support group leaders. We have people from corporates and pharmaceuticals. We have such a network of people, and I thank you again for your time in joining us this morning to be part of this conversation. We are recording and we are streaming on Facebook to get this information out as much as possible. But I'd love to hear from you, and if you can just take 1 minute to post in the chat box what mental health matters to you. If you can finish the sentence and complete the sentence on mental health matters because, and post it in the chat box. We'd love to hear from you. While you're filling that in and posting in the chat box, and we love to see all those comments, I think it's important to set the stage and share from SADAG's insights on what we're seeing in the call center, especially post-COVID in the last 18 months. Just from January at the beginning of this year, we've received over 466,000 calls to our helplines. 1 in every 5 calls are a suicide-related issue that our counselors are dealing with on a daily basis. And just to the suicide helpline, since January till the end of September, we've received over 85,000 calls from people around the country who are feeling helpless and hopeless and reaching out for help. And while these figures are alarming and shocking that there are so many people who are really battling, I'm also really encouraged that so many people have reached out and that are calling and reaching out to SADAG. It's very encouraging to see that number improving and increasing. When we're also looking at the moment, which is different to before lockdown or before pre-COVID, March 2020, we were getting about 600 calls per day into our helplines. From the first day of lockdown, we had received, our call volumes doubled overnight to 1,200 calls per day. We're now averaging around 2,200 incoming calls to our helplines every single day. We've also seen a huge increase in the number of people reaching out by SMS, WhatsApp, email, and social media. So again, we're encouraged that so many more people are reaching out, and we've definitely noticed more people reaching out online and going through our online platforms to reach out for help and using digital platforms to reach out for help. If we're looking at the number of calls from 2019, our pre-COVID world, to now, the 160% increase in the people reaching out for help, which tells us the direct impact of mental health. And we're also looking at some of the stats around mental health in South Africa. We know that 1 in 3 South Africans will or do have a mental health issue at some point in their lifetime. And some of the treatment gap, which I'm really thrilled to have someone like Professor Lynch for this morning, because he's done a lot of research in this field. The treatment gap in South Africa is only 1 in 10 South Africans who have a mental health issue have access or do access treatment. We're needing to do so much better for mental health care in South Africa. And this is the platform that we get to start these important conversations with the right people from different sectors to come together and say, what can we do and what can we do more? We know that the mental health impact during COVID has been immense. We've seen that at SADAG, but we've also seen lots of research and reports around that. That can also tell us that even from international research, that the mental health impact of COVID is now being deemed the second pandemic. With each wave that we find in the COVID pandemic virus is that we're seeing more people reaching out, calling us, needing some more help, accessing more services in their communities. And this is why the state of mental health is an important topic to discuss today and every day, but also with the international theme for World Mental Health Day being mental health in an unequal world. This is the time that we can talk about this topic because it's so relevant to South Africa. And thank you to everyone for posting your comments and telling us mental health matters because we all matter. No one should suffer in silence. Thank you, Rochelle. My mental health matters because my physical well-being and that of those around me will be impacted positively or negatively by it. So thank you. This morning, I'd like to share some of our speakers and our panel discussion as we get this conversation going. And we're really honored to have them this morning. And I'd like to introduce Professor Lynch. And we've all seen him in many papers and in many forums and discussions around the world. So we're very honored for his time this morning. There is more for his bio, and there's probably pages more that we're missing. But Professor Lynch is the Professor for Global Mental Health and Development. Also has his PhD. He's a Professor of Global Mental Health and Development in the Center for Global Mental Health, the Institute of Psychiatry, Psychology and Neuroscience at King's College London, and a Professor in the Alan Fisher Center for Public Mental Health, the Department of Psychiatry and Mental Health at the University of Cape Town. We also have Taz Satole, who is the founder of Her Luxurious Healing and is a holistic life curator. She has the privilege of being a healer or a sangoma and using her ancient healing practices in her work every single day. She also holds an LLB degree, an LLM degree, and an MBA, and we really appreciate your time this morning. We also have Dr. Kahisho, who I have the pleasure of working with, and even just yesterday had some meetings and discussions. He is both the South African Society of Psychiatrists, or SASOP board member, and public sector national convener. He's also a healthcare professional specializing in psychiatry and is a distinguished lecturer at the university. So this morning, as we discuss this, I'm going to ask our speakers to come forward and have you up. Good morning, Professor Kirkland. How are you?
I'm doing good, Cassie. Thanks very much. Great to be with all of you. Thank you so much.
Thank you very much. And good morning, Taz. Thank you so much for your time. And Dr. Kahisho, thank you very, very much. This is going to be an interactional discussion. I'm really just hearing from everyone this morning. So I'd like to get the ball rolling with asking and posing a question. And then I'm going to ask my colleague, Senzakile, who's going to be helping us with our Q&A and the questions that we have received to really just have a discussion around this. And if anyone has any other questions that you'd like us to ask, please do post them in the chat box. We want to learn from everyone this morning. So I'd like to just maybe start off with the theme that we've had for World Mental Health Day. And maybe just to start off with, and maybe Professor Lynch, I can start with you on the current state of mental health and how the theme of mental health in an unequal world relates so much to South Africa right now.
Thanks very much, Cassie. I think this theme of mental health in an unequal world is so relevant for us right now, and especially with the global pandemic. The pandemic is exerting its influence not only directly through raising people's anxiety and stress related to the experience of, the threat of illness or having loved ones who are lost, but also through the economic impacts. What COVID has done is it's precipitated a global economic recession. And we know that many of the social and economic drivers of mental health are incredibly important at a population level. So increased unemployment, food insecurity, gender-based violence, these are all drivers of mental health problems. And it's very striking to see those figures you were presenting earlier on the increased demand for mental health care. And the wonderful service that SADAG renders. And clearly there's such a huge increased demand that's being driven by this whole COVID situation. So I think it's really important when we think about mental health for our country as a whole and indeed other countries, that it's not only about providing treatment and care, which is incredibly important in its own right, but it's also about advocating for better living conditions for all. You know, it's about providing basic food security, income security, reducing gender-based violence. The more that we can do to address these upstream drivers of mental health problems, the better. So, you know, by adopting this broader approach to mental health, which includes addressing inequalities, we, I think, are in a much better position to try and address mental health as a country.
Thank you so much. And really, really fantastic insights. And maybe, Taz, I could come through to you, and from your experience and the work that you've been doing, I know that you also use the online space to create awareness. What have you seen, even just in, you know, during COVID, the impact on mental health, and how do you see, you know, mental health in an unequal world? What does that look like, and from your experience?
Thank you so much. You know, for me, COVID has really exacerbated what has already been an unequal world, especially for African people, because already the dominant narrative that we've been operating under has not included African people, access to land, access to rites of passage. So when COVID came along, it also meant that now we could not carry out rites of passage, we could not access spaces that we needed to heal people, and especially for people in indigenous cultures who, with their mental health comes great spiritual health. So that was a big struggle that has actually created a spiritual gap from what we can see. Because when we do not have a place that we can call our spiritual home or access to the rites of passage and the rituals that we do, then we are really ungrounded. So if we look at the idea that people were struggling because of work and food, and that things were already unequal, and then we put in COVID in there, people are losing people, we can't do the rites of passages for deaths, and we see that people are really, really affected by that. And now not only do we have problems in this realm, then now we also have problems in the ancestral realm for African people as well.
Thank you so much for bringing that in. I think that's an important conversation, especially in the South African context, really just looking at, you know, who mental health is impacting and affecting. So thank you for bringing in. I look forward to the discussion and more of the questions around that. Dr. Kagiso, you know, you work a lot in state sector and clinics and hospitals. What are you seeing, and what is the current state of mental health, and where do we kind of fit at the moment?
Yeah, thank you, Cassie. And good morning to my colleagues on the panel and the rest of the colleagues who have joined. I think we're seeing sort of like more of the same, really, for what to put it. I mean, I think I've been involved in mental health for quite a long time, and the high prevalence rate has been there for quite some time. Professor Lynch will know that, and the problems of the huge treatment gap has also been there for a long time. There's been emphasis on the social determinants that lead to mental illness, but these have not been addressed by social or economic authorities. And now we have COVID, which, like we've said before, have laid bare all these problems that they're experiencing. And then problem secondary to that, now people don't know whether to seek medical attention or not, because there's this whole story of going to the hospital and I may die. So now they're in the community, but in the community, they're not finding help. You know, which is where they should be finding help. You know, clinics are not well resourced, so we're having that kind of a problem. So it kind of, COVID should actually make us reevaluate what should we have done 10, 20, 30 years ago. And maybe this is a chance to, you know, lay the foundation to start everything afresh, looking at social determinants, looking at, you know, like the spiritual importance, religious importance of all these matters, and addressing those things instead of always hoping that the medication will solve everything. Thank you.
Absolutely. Thank you very, very much. And I know we've got tons of questions coming in. So thank you again. I'm now going to hand over to my colleague, Senzikile, who's going to help with the Q&A discussion around this. So I look forward to that. Senzi, over to you.
Thank you so much, Cassie. And I'm really honored today to be speaking to this panelist. I mean, I've heard so much about all three of you guys, and I do think that we have quite a lot to learn today. I personally have quite a lot to learn today with regards to mental health in an unequal world. And I'm going to pose a question now to all three of you guys, just to start off with. 22 months ago, we were bombarded with this thing called COVID-19. It was this big pandemic that was going to change how we live. It was going to change our lives. And ever since then, quite a lot of people have been experiencing mental health issues. Quite a lot of people are talking about mental health. Quite a lot of people have been diagnosed with mental health related issues. In your experience, what has the mental health impact been during COVID-19? And what do you think we should be focusing on going forward to tackle mental health related issues, especially in the world of COVID? Prof. Crick, you can start.
Okay, be interested to hear what the other colleagues on the panel have to say. That's a great question. Thank you so much. Yeah, I think the evidence is really becoming clear. There was a paper published in The Lancet just last week looking at trends of the prevalence of mental health problems before, during, with the onset of COVID and more recently. And there's a clear trend around the world, that the prevalence of mental health problems is increasing in response to the COVID pandemic. And I think for me, there are two really important drivers of this. The one is the threat of illness itself, which creates a lot of anxiety, and especially for people who are living with mental health problems, a lot of fear, a lot of sadness and loss associated with losing loved ones. So there's that very direct impact of a pandemic and what it does to everybody's sense of security and emotional well-being. But there's also, as I mentioned, all the pressure on the economic circumstances. And as Taz was saying as well, this also has a bearing on people's normal ways of coping with adversity, their normal rites of passage. This includes spiritual practices, which they would normally be able to undertake to cope with this adversity. A lot of those opportunities are now removed. So it's really like a pressure cooker. All the factors that we know are associated with mental health problems, they've been kind of ratcheted up. And so we see, this enormous pressure building. And I think it's really important that governments, first of all, are aware and give adequate attention to mental health as a really important policy issue. It's an important health issue, but it's also an economic issue, because we know that people living with mental health problems are less economically productive. And so this is likely to have a huge knock-on effect on economic productivity, on social cohesion. So mental health isn't just a mental health issue. It's also a social issue. It's a spiritual issue. It's an economic issue. And this is why we need to be talking about it more in forums like this. We need to create more public awareness. And we need to get people who live with mental health problems to share their stories and to be part of an advocacy movement to give attention to this issue. Thanks very much.
Very interesting. I like the issue that you're pointing out on economic productivity, which is something that has been very prevalent in times of COVID-19, and people have been really struggling with that, which is a very interesting point there. Tess?
Thank you. And I speak as a Sangoma, for the greater part, when people have come to us, we've been able to solve their issues. But with what COVID did, it actually gave us a helplessness, because this was something new, nothing that we can prescribe or take out into the environment. So for me, it also talked to the importance of collaborating, with the scientific community and with people with knowledge around that, and how we can now bring it back to our community. And for me, it also reminds me that we also need to go back to basics, to the things that we did foundationally as a people that give us grounding, so that we actually come up from that strength. If we look at what we had, and as an African healer, I can only speak from an African perspective, we had birth rituals that started with people have sex during the day, not at night when they're tired, because it's an exchange of energy. When you then get pregnant with that child, there's rites of passages and listening that you do so that you can bring a healthy child into the world. You know what their purpose is, you know their name before they're born. Then when there's a cycle of intelligence at 7 and 14, we do rites of passage. Consciousness awakening at 11 and 22, then into adulthood, and then into eldership. So that within the community gave us a sense of grounding and an understanding of purpose, spirituality, and who we are. So now, without that, and then we have COVID, we have all this uncertainty. Who are we? And that's what goes to exacerbating all of that.
And if you can think about it, this whole time where we have been in lockdown, in and out, spending time with our families, it has really contributed in us getting to know ourselves, and not just ourselves, even the people that are close to us, getting to understand our minds, getting to understand our bodies, how we think and how we behave. And in a sense, that is a benefit to it. And we have also gotten an opportunity to explore different treatment plans. Dr. Kagisho. You can unmute yourself.
Okay, thank you very much. Yeah, I think, and I'm going to touch on some of the issues that Professor Land spoke about. I mean, just throughout the whole pandemic, there have been various points or factors that has led to mental illness. The first one was just the emergence of this COVID that no one knew about. Maybe other countries, especially in Asia, they were sort of more accustomed to sort of biological disasters, but us, we've never been exposed to this. So the question is, how do we deal with it? I mean, the one thing that I did at the beginning of COVID, I really immersed myself in a lot of literature, but I can do that because I've got access to it to get to a point where I understand what is going on, and that eased my anxiety. But I can see that for everyone else, that wasn't the case. And instead, there was an emergence of conspiracy theories. And obviously, when that happens, then they can sort of be more aligned to those. And you know, those conspiracy theories can be fake news. The other issue is that there was this sort of almost less lackadaisical expectation that people would just socially isolate, because they need to protect themselves. But I think, as we've all realized, that is a very unnatural state of being. We all want to interact with other people, whether it's family, whether it's friends, whether it's colleagues. And this sheer state of social isolation has caused a lot of our problems in terms of mental illness. And it sort of leads to silent, prolonged psychological distress. It may not meet the criteria according to DSM-5 or 4, but it does lead to emotional distress, and that can impact on your functioning. So you're no longer socially well adjusted as before. Function at work, you're not performing as well as you perform. And then now you've got the big boss who's under pressure, obviously, to deliver whatever they need to deliver. And you are sort of like the lazy employee, and now you're threatening with unemployment, you know. And what we're seeing now with level 1 and people rushing back to taverns and restaurants is because the new normal just doesn't work for people. I think we might just understand that. It just, you know, there's all this expectation that we can all be at home, work on a computer, but it's a very difficult way of existing. And perhaps this is where the importance of vaccination comes in, where people can go back to normality, because otherwise it's very difficult to work in isolation. Thank you.
Dr. Kagisho, you are literally bringing up such important pointers here, in the sense that what really is normal anymore? Because you spoke about the new normal, and then you said, but the new normal is not normal because everyone is now rushing to go back to taverns and doing the things that they used to do. But also what I have personally realized is that us being now on a lockdown level 1, for some people, they still have the fear of going out and interacting, because I have a fear that I might get COVID. I have a fear that I might make the people that are close to me sick. So it is emotionally and psychologically draining. And my question is, what really is normal anymore? Is it normal for me to stay at home and not go out? Is it normal for me to get an opportunity to go out and not use it? Is it normal for me to say, okay, there is an opportunity for me to get out, but I'm going to use it and I'm going to use it hard? What really is normal, and how should we really behave?
Well, I don't know. I think, I mean, to expect people within a course of 6 months to change their whole way of living for the past 200 or 300 years, it's just so difficult, you know. And for some people, they were just emerging from the economic distress. Now they're exposed, they can go to restaurants, they've got cars, they can travel. And all of a sudden you're saying, you know, you're curtailing those activities. I'm sure they feel that, you know, this is not fair. I mean, I'm just sort of getting out of this poverty environment that I have, and I'm succeeding. I need to be shown to be succeeding. I want to succeed as well. So I think we need to accept that, you know, the new normal may not be the solution for everything, and we need to think either people protect themselves as they go out, you know, keep the gatherings small, and like I said, we vaccinate so that people can do what they need to do. And I think that's in America, they're realizing that. So They just don't want to wear masks. They just don't want to wear masks. And the only way of countering that is just to vaccinate them, basically. Yeah, thank you.
Thank you. And what I'm getting from what you're saying is, let us not want to define what normal is. You know, let us take each day as it comes, because it isn't normal to be in this COVID-19 situation. And the reality is a lot of us have been affected mentally because of the constant shift to living our lives differently, to living our lives and trying to go back to how our lives used to be. All of it isn't normal, and we should really take things as we go along. Prof. Lynch, this is for you. Do you think that we have got enough mental health resources currently in South Africa to meet the amount of demand that is needed for mental health care?
Yeah, thanks, Senzikiwe. The short answer is no. You know, we really don't have enough mental health resources, and I think all the research shows this. As Cassie was saying, that, you know, the evidence is that only 1 in 10 out of every person living with a mental health problem actually accesses care. So that's a huge gap, and we refer to that as the treatment gap. And so, you know, I think it's absolutely vital that that governments, including the South African government, take this seriously, and we need more resources allocated. What is encouraging from the research is that I think there are new models of care which are being evaluated and being shown to be highly effective. And one is the approach of what is called task sharing or task shifting. And this involves training and supporting non-specialist health providers to provide basic mental health care and or to detect mental health problems and refer them to specialists. So we've been doing some research on this. I was involved in a study called the PRIME study. It's the Program for Improving Mental Health Care. And we set up one district demonstration site in each country. There were 5 countries involved. So it was Ethiopia, India, Nepal, South Africa, and Uganda. And in the South African site, we worked in the Dr. Kenneth Kaunda district in the Northwest province and worked with the local district health management team to develop a district mental health plan. And that involved training primary care nurses to detect and refer problems like depression, alcohol use problems. And also we included a psychosocial rehabilitation program run by non-specialist health workers for people living with schizophrenia. So really trying to maximize all the resources that are available within the existing district, providing support and training from psychiatrists and psychologists. So this sort of model of sharing the care, you know, sharing the resources, using the maximum use of the available resources, I think is one way in which we can go forward. Of course, we need to also train more specialists. We need more psychiatrists, more psychologists, more mental health nurses, occupational therapists, and we need to build that resource. But I think we can also be innovative. And there's some quite exciting examples of this from around the world, from work in India, in Pakistan, in Chile, in Zimbabwe, the Friendship Bench intervention, which uses community health workers, often gogos, grandmothers, to provide basic counseling. These have been shown to be highly effective in randomized controlled trials published in the top scientific journals like The Lancet and the Journal of the American Medical Association. So I think, you know, while it's a really challenging situation and clearly we don't have enough, I think there's quite encouraging evidence about what we could be doing to address this treatment gap.
The short answer is no, but there is always something that we can do about it, right? I like the idea of having non-professional or non-HPCSA registered professionals doing these containments, these debriefing sessions, and these basic counseling sessions, so that we can bridge the gap, especially in communities where they do not have enough money to see a psychiatrist, especially a private psychiatrist, or they do not have enough money to see a private psychologist. But there are people that can actually help, that can be trained, that can help to contain people, especially emotionally and psychologically. Dr. Kagiso, there has been so much confusion with mental health professionals. And for the purpose of our audience, could you please elaborate what kind of mental health professionals do we have? I know we've got a lot of confusion with regards to what is the difference between a psychologist and a psychiatrist. What does a social worker do? What does a registered counselor do? Could you highlight for us what are the different mental health experts that have been trained to help us with our mental health conditions, and how do we best utilize them?
Yeah, thank you for the question. I think while I'm answering, perhaps back to Professor Lind and to Taz, the issue of task sharing, it is obviously quite good because there's limited amount of specialists in the service, but isn't there not a risk of this another generalist doing the same thing that a psychiatrist could have done instead of doing something different? You know, I can, to answer your question, Mr. Shongwe, obviously as a psychiatrist, my emphasis is on finding medication, making the diagnosis and treating your depression accordingly, going from the first line, second line, and third line. But sometimes I need a different approach, and obviously a different profession should be able to do that. And I think sometimes with task sharing, you find that the generalist will do this exactly the same thing as a psychiatrist, and it really doesn't really help. But basically, like I said, the psychiatrist will prescribe medication for the patients, you know, make a diagnosis, rule out if the patient has got another medical condition that could have led to the mental distress or disorder, and rule out substances. And then a psychologist, and obviously Professor Lind will know this better, will basically to look at the behavioral interventions that can change the behavior, basically, or the thought process. So that's what they will look at. And also looking at the thinking of the patient, you may find that they've got negative distortions that are leading to the anxiety and the distress. So you need to change those negative distortions. The social workers basically come in to providing with additional information, collateral information. They would do home visits, and I think this is very important too, so as to know the circumstances of the patient so that we can address them as well. It may be enough for me to ameliorate the depression, but if the situation at home is still the same, then obviously that doesn't help. And then the OT will look at things like functionality of the patient. Can this person go back to work and work optimally, or there are things that I need to train the patient to adapt? And even OTs can do things like financial health education, for example, how to do a budget. We take it for granted that maybe a 44-year-old will know how to do a budget, but they may not be the case. So those are the things that you can teach. So it's OT, social workers, psychologists, psychiatrists. And also it's important sometimes you have a generalist, like a medical officer or a physician, just to manage the physical needs of the patient as well.
Mm. And Dr. Kagiso, do you think that we are utilizing social workers and registered counselors enough in communities, or do we always just jump to GP, psychiatrists, psychologists?
I mean, we definitely need them, and that's what has been said earlier, that there's lack of resources in this in this aspect. So we are having a lot of social workers, OTs, dietitians in the community now, and now we can provide an MDT sort of approach in the community instead of having to go to the hospital to access those services. Thanks.
Perfect, thank you. Prof. Lind, from a recent SASOB press release, it was stated that only 25% of psychiatrists work in state sector, which is very shocking, while 75% work in private sector. How do we balance this out more in our local state sector where the need is the greatest?
Yeah, thanks, Tenzakile. I think it's really important that we create more posts for psychiatrists in the public sector, you know, and that's about government investing, thinking that this is an important issue and that it's really important to employ psychiatrists in the public sector because their role is so vital. You know, I think the current situation is that we simply don't have enough posts. You know, that's the first thing is to invest more, create better budgets. The second, and I think just to also respond to Kagisho's point, I think we need to develop more collaborative ways of caring. And I think this is exactly what he was saying, is that task sharing isn't about shifting from a psychiatrist to a medical officer to do the same thing. It's also about developing teams who work together in a collaborative care model. And there's growing evidence for this idea of collaborative care, having a nurse who's the initial point of contact, who may then refer somebody for medication assessment, either to a medical officer or a psychiatrist if a psychiatrist is available, but then also refer to a B-Psych counselor who can provide basic counseling. And this is the other point I wanted to make, is that the B-Psych counselors, I think, are a hugely underutilized resource. This post was created specifically to fill this gap between psychologists who require 6 years of training and really to provide evidence-based counseling. And we have now this huge number of B-Psych counselors who've been trained in the country, but there are no posts in the public sector. And again, I think the Department of Health and Department of Social Development and also the Department of Basic Education needs to create these posts and put people in the field to provide the care that's so desperately needed. Thanks.
And I couldn't agree with you more. You do not know how many registered counselors that I have spoken to and social workers who are unemployed. But when you look at communities, there is such great need for them, which is very shocking. And it just blows my mind to say that, how can these people be unemployed? How can these people not have opportunities where there is such a great need for their services? Back to you, Prof. Lind, why do you think that the gap is so big between private and public sector? Why do you think this happens?
Well, I think it's largely driven by economic forces. So firstly, if you qualify as a psychiatrist, it's very difficult to get a post in the public sector. And if you set up as a private practice psychiatrist, you can get patients paying you out of pocket or through medical aid. Medical aids provide some cover for psychiatrists, I think more so than psychologists. And so it's possible to earn a living, to deliver care. But what effectively the system is doing is it's providing care for the 10 to 15% of the population who can afford either to pay out of pocket or who can afford private medical aids. And so that means a huge treatment gap. And it's what public health practitioners often refer to as the inverse care law. Those people who have the most needs for care have the least access to care. And so it's really being driven by these economic forces. If you were setting up as a psychiatrist, you were qualified, you couldn't find a job in the public sector, where would you go? Of course, you would set up your private practice and away you go. So this is where the NHI, the National Health Insurance, is going to be extremely important. It's really important. And as a group of people involved in mental health, it's also really important that we come together and advocate for the inclusion of mental health care in the National Health Insurance. Because here's an opportunity. While the NHI is being set up, while the packages of care are being defined, we need to make sure that care delivered by mental health professionals is included in there. Thanks.
And how closer are we actually to closing the treatment gap of 1 in 10 South Africans with a mental illness accessing mental health care? Are we getting any closer?
I don't know. We don't really have data over time. A lot of these studies are really being done in the last 10 years. So we don't really have longitudinal data to show the trends. I think globally there are some encouraging trends. We're seeing more and more countries developing national mental health policies. On the African continent, I think in 2001, when the first World Health Report was published on mental health, there were around 50% of African countries had a mental health policy. Now I think it's close to around 72, 75%. So we're moving in the right direction. But I think the budgets often don't follow. We need investment cases. And I think, to the Department of Health's credit, they've just commissioned a national mental health investment case, which I've been involved in working with some health economists. And this shows quite clearly, that the cost of actually investing in mental health services is actually really a good investment, because it leads to, at a societal level, a return on investment in terms of economic productivity gains. And so this report we've just submitted to the Department of Health is under review by the department, and we're hoping that it'll be taken forward.
So we're moving in the right direction, Prof. Lind, but we're not quite there.
Yeah, and the movement is slow. I think all of us working in the field, working as mental health professionals, also as traditional healers, I think we see this huge need. And there's just it's not enough and it's too little at the moment.
Dr. Kagiso and Prof. Lynch, please do add if there's anything to add after this question. There is often the fear with accessing help from local government clinics, especially now during COVID-19, and stigma and barriers to accessing mental health care. How can communities, especially in the townships, access mental health assistance with ease? And how do we break these barriers to care?
Yes, I can go first. Yeah, I think we need to move a little bit away from focusing purely on health settings, traditionally your clinics and your hospitals, and think of non-health settings. Before there's things like churches, youth centers, or any sort of spiritual centers, or even non-traditional healers. I think we should look at them as being people that can maybe help us identify distress. And the person will go there and say, I'm having this obviously social determinant, this divorce, I'm going through a divorce, financial problems, I'm not sure what's going on. I think this could be, and I really hope that Tess will sort of get into that and explain to you a little bit more about, why would people be visiting traditional healers? What do they hope to gain? And can they help them? But also thinking that they can also identify where a person needs a doctor, and then that's where they can come to us. So I think the emphasis is not only on people just rushing to hospitals and clinics. They should be looking at non-health settings and see whether they can get help there. Because I've had it before where I would have a patient, I would do my bit in terms of Western medication, but I would still insist that they go consult either a pastor or a traditional healer, because there are aspects that I've not been able to take care of, and I need another colleague to be able to take care of them.
Mm-hmm. And that's a very important point, because we think that it's either I go to the clinic, I go to the hospital, I see a psychologist, but there is really nothing wrong with integrating these different treatment plans and these different professionals and getting holistic assistance, which will bring us to what Tess will contribute towards this conversation. Prof. Lynch, anything to add?
Just to say, I really agree with Kagiso. I think we really need to adopt a holistic approach to healing and to mental health care. Just to share one example, my colleague, Prof. Oye Gureje in Nigeria has done a wonderful study working with traditional healers in rural Nigeria. And it was a cluster randomized controlled trial that they did. So essentially, in the intervention villages, they set up collaborative care between traditional healers and the primary care clinics. And there were referrals in both directions. So people who were picked up at the clinics, if they needed to see a traditional healer, were referred to the local traditional healer. If there were people living in the traditional healers' camps who needed medication or other kinds of support, they were referred to the clinic. And so in each of the villages, they set up these collaborative care models. And then in the control villages, there was just business as usual, traditional healers operating completely separately from the clinics. And what they found was in the intervention villages, a significant improvement in clinical symptoms and reductions in disability, and also reductions in harmful practices across both the control and the intervention villages. So really, really interesting. And again, this was published in The Lancet just last year. If anyone's interested, please go and have a look. It's Oye Gureje was the first author. And I think it shows us in South Africa what's possible. And I think we should be doing more of this, both as a research, but also as practice, working collaboratively, with traditional healers and the public sector together, because as a nation, we really need to go on a journey of healing. This is really what it's about. So thanks. I'd be interested to hear Taz's thoughts on this. Thanks.
Taz, do you want to add? They're both interested to hear what you'd like to say.
Because I think for now, patients are left with self-directing themselves. Personally, I work with a lot of professionals, from advocates, lawyers, medical doctors, as my patients. And these are people who also know that when they need to get psychiatric help, they go and they get that, they admit themselves, then they come back, and then I deal with them. Before I answer the question, I can give you a cheat code to check if, let's say, is it a mental illness or is it something that is ancestrally related, right? Spiritual. You ask them, do you have lower back pain? because that's where the umbelimi is, the kundalini, right? And for that snake to arise, and if that chakras need alignment, it always starts there. So that's a good cheat code to check how do you feel on your lower back, and then you can see which direction to go, you know. What was the question? I've forgotten now.
So the question was around breaking the barrier to care, especially in communities.
Okay. You know, I think the interesting thing about stats is those are the informal stats that people also do not see. For instance, during COVID, I've been part of a lot of sessions. We call them sacred healing circles, where we've been having sessions, especially with women, to heal the divine feminine. I was part of one that was 2 weeks ago around womb healing, where women got together and we spoke about what do we need to heal now that we've been given this break in order to heal. So we held space for each other. So there are all these little informal things that are happening that are not being tracked as well. And what also happens with us as healers is it's a little bit different around, because it's not like who's on the register, who's on the list. Sometimes you will dream of us, you get a sense of it, and you will come to us and we'll help you. So the ways of doing things are also quite different, right? And we do it from a space of channeling and finding out what is happening in your bloodline. So we really go back to the beginning. Do you know your family tree? Do you know that this actually happened in your bloodline? Let's cleanse this. Let's protect you and then allow you to move forward. So I find that, let's say with people who are struggling at work, we're talking about now the idea of, now I'm unemployed, but other people are still employed, other people still have money. What is the difference between you and those people? Have you taken care of the things in your family, in your bloodline that you need to take care of? And we know that we did not originate capitalism in the form that it is. So when we are working with things like economics, when we're working with jobs, finding new work, we call on what we call the water spirits or umdao. They govern all of that. So are your water spirits, are your umdao aligned? Is your back sore? Are your chakras aligned? If that is in alignment, then we know that people get jobs. So we've gotten a lot of people coming through to say, oh, now I'm unemployed because this has happened. So we go in, we cleanse the bloodline, we align their umdao. Within a week, they have a job. So there are all those things where we can't prove, where we can't show, but there are these things that we're doing in the background and where people are actually getting healing. Yeah.
And that is very interesting in the sense that with the African or traditional perspective, you actually go back and you actually research and you assist in doing that to say, who are your ancestors? What is your bloodline? You help people understand their roots before you actually tackle the issue. Now, I'm interested in knowing, in terms of mental health conditions, if someone comes to you and they say, I have got certain symptoms, and when you look at these symptoms, they look like symptoms of probably a mood disorder, or they have been told by a psychiatrist that they have a bipolar mood disorder, for example. Are there things or techniques that you as a traditional healer or a sangoma uses in a sense of treating this kind of a person?
So we don't ask you, what are your symptoms?
Okay.
When you walk in, we know what your symptoms are. We tell you, and then we also remind you of the things that you've forgotten. Right. So those are words that we might not use because we get the words from what is happening. Not all mental illness requires initiation, right? Some of it is a misalignment. So we always speak, I love the story of the African origin story where we have Ose and Oset, where Ose is killed and is chopped up into different pieces, and then one piece of him is lost. So when we speak of being African, we speak of the idea of remembering, coming together, all the parts of us that have been lost. So it is perfectly okay that we also go to the Western methods of healing because maybe that piece is lost there. But what about the parts that are lost for you within your own bloodline and within yourself? Because with everything that is going on, I know that with depression, especially in women, when it presents, when I have my female patients, they feel like they're failing. They can't even pinpoint it as depression. So from a diagnosing perspective, like we also need to show people what is depression, because people also don't know what it feels like. So now the idea is we want to bring in a new birth, a remembering, a coming together of who you are. And that is our job. And I think that is the beauty of, I mean, like for me, I can tell if a person is pregnant, right? But I can tell you, you're going to have a girl and this is what their purpose is. And I don't need any diagnostic tools, right? So we know because we are guided, because we carry a gift. So if we're working and we're working separately without coming together, I think it's a loss for everybody if we don't come together and come up with ways that we can help, because we are the ones that are in the community. We're the ones that see people every day.
Sure. So interesting. Now, let us say I come to you and you can sense and you can feel that this person is actually depressed, right? And I know we can go through my bloodline, we can have a conversation about it, and we can actually see what is making me feel this way and how we can move forward with it. But if in a sense where it is clinical, maybe I'm someone that is experiencing severe symptoms of depression in that sense, do you as a traditional healer say, okay, I think it's a good idea for us to integrate both. I think it's a good idea for you to also see a clinical psychologist or for you to see a psychiatrist?
Mm-hmm. Absolutely. I work closely with Dr. Tamara Pfeiffer as well, with the work that she does. And I will definitely refer people, because sometimes if we haven't taken care of your symptoms, you can't even sit down and listen to me. So for me, it's always important to have that. We can't bypass it. In any case, even if it was something spiritual, right, it is going to have an impact on you physically. And that will need other interventions other than what we can do. So that is always important, that that collaboration happens.
And I'd like for Prof. Lynch and Dr. Kagisho to add here. There is a common perception that treatment for mental illness is either traditional or it is Western, right? With psychiatry and psychology. Is there rather an opportunity for both treatment paradigms to work together? Do you actually, as a mental health professional, would you suggest that your client or your patient sees a sangoma or a traditional healer?
Should I go first? And Kagisho?
Yes, you may.
Yeah, so thank you so much. I mean, I think this is a great question, and I really am a huge advocate for collaborative care, you know, for working together and bringing together different traditions of healing. I know that at Valkenburg Hospital, just down the road from where I'm speaking to you today, in some of the wards, my colleagues will bring in traditional healers to consult with the patients, to allow them to undertake certain rites of passage while they're also going through treatment at Valkenburg Hospital. So, you know, I think there's increasing awareness from the side of psychiatrists and psychologists of the importance of bringing together, you know, worlds which in the past have been separated. And I don't work, I'm mainly doing research, so I don't see individual clients at the moment. But certainly if I was, I would be very open to and very keen to work with traditional healers. And as I mentioned, you know, from the example from Nigeria that I shared earlier on, there's good research evidence this can work really well, because people bring their own spiritual beliefs, their own spiritual experiences, and they experience their symptoms in relation to those spiritual traditions. So it's very important that they address that side of themselves. No one is only a set of mental health symptoms. They also have a story, they have a culture, they have a sense of meaning and purpose that they bring to their worlds. And so all of these things are important when we're thinking about mental health.
Perfect. And Dr. Kagisho?
Yes, thank you. I think just extending on the meaning of things, as Prof. Lynch said. So I think, for example, somebody may have lived a life with an absent father, for example, and obviously then they feel that, you know, then they can either present to Taz or to me, you know, and for various different reasons, you know. So they may feel that the absence of the father is why I'm not getting work, because I don't know his surname, I don't know, you know, his bloodline. I need to find this man very quickly so I can get work. And unfortunately, not unfortunately, but fortunately, you may find that, you know, traditional healers like Taz may be more equipped to deal with that issue. Whereas for me, you find that the absence of the father itself leads to depression, you know, and that depression is affecting the ability to work, the ability to function at work. And my job will be to treat the depression. but the fact that he still believes that, something is amiss here. Doctor, thank you very much. After 3 weeks, I'm fine, but I still feel that I need to make this connection. I can't do that. I need to be able to have the humility to send the patient over to TAS to take care of that. So just an example of how, when you look at the patient in the whole person care model, then you'll find that you're going to need a social worker, you're going to need a counselor, you're going to need TAS, you're going to need a physician. Especially with mental illness, it's very rare that one thing only led you to the doctor's room. They will come and say that I was in an accident 6 months ago, but as you speak to them, that all sorts of other things come up, then you realize that you need a whole team in order to be able to handle those issues.
And would you then highlight to them to say, I think because of 1, 2, 3, you may want to see a spiritual somebody, you may want to see a traditional healer, or do you want them to pose it to you first, Dr. Kagisho, to say that I think that I should be seeing a Sangoma, but I'm not too sure, or do you sometimes bring that forth as an option to them?
I think if you allow them, if you have a conversation with patients, it tends to come out at some point,
okay.
Where they have this belief, and you can ask sort of questions, in that regard as well. If somebody, for example, has miscarried, you can ask, what do you think could be the cause of this? And then, then obviously they'll talk about the gynae said this, and this one said this. Is there anything else that you think? And then eventually they may feel that, okay, I think I can be more comfortable to tell the doctor my own sort of spiritual causation theory, so to speak. And then you just listen to them. And obviously you have to be honest with them and say, I can do my bit, but you may need to seek help elsewhere with a spiritual counselor. And oftentimes they were already in the process of doing that, and sometimes if you as a Western medicine doctor encourages that, then they may just take the step and go forward with that.
And I like that it's not all black and white, right? You have to have a conversation with your patient or client in the sense that if you have a conversation with them, those things will come out. And I'm very, I'm happy to hear that you're saying in most cases, you might find that they're already in the process of doing that, meaning people are really integrating both modern or rather Western and traditional ways of treatment. Taz, can you paint us a picture? What does traditional treatment look like for mental health issues, right? Tell me, how do I firstly know which traditional healer I should go to? And how do I find a traditional healer? We work at SADAG, and in our referral guide, it's really hard to put traditional healers because we don't know where to find them. We do not know where they are, right? So if somebody comes and they say that, I think I need to see a traditional healer, how do we advise them as to how do they find one and how do they know if that one is good for them?
I think it's unfair sometimes that work that should be done by family members, aunts, uncles, grandmothers, grandfathers, is now being put on professionals, because now we're acting like people without homes, as people who don't come from other people. You send them back home. Go ask your brother. Have you asked your father? Have you asked your brother? Who in your circle have you asked? Because sometimes now we are lazy to think, and we just want to pass it on, right, to other people. So you ask them to go back. My belief is every family has a healer. There's somebody in your bloodline that is a healer. That is why we are here. We're here to heal our bloodlines first. And when we've got extra time, we can give our time up to society, right? But we're here to heal our bloodlines first. So nobody in my family can go somewhere else and be like, I don't know where there's a healer. They must go ask my mother, right? And then people will be referred to me. So some of these things, we need to take it back to the family. We need to do our homework, because what I also find is not all of us are honest as well. So if you're also not going internally to first then pray to say, is this the right person that can help me, and get a sign? Like I said, we work a little bit different. You need a sign around that. So how we work is we always start with a divination, where we check to see what is going on and what the problem is. What I then personally do is I go into your bloodline and I heal that miasma that is within your bloodline. So I can heal it with ritual, depending on what we are shown. Then I come to you as a person, right? Then even if I cleanse you, if you're going to go back to your old habits, we're going to be doing these individual rituals all the time. How do you live your life? Do you understand ma'at? What does that mean? Do you understand how to bring balance into your life? How do you want to live your life? Are you on purpose? What is your purpose? Then we go into all of that. So after we do that cleansing, then we do another rite of passage of invitation of the things that are good, invitation of your gifts, invitation of your purpose, and then we bring your chakras into alignment. Then we always end off with a celebration where we now call in family to come say, here's your new person who was going through 1, 2, 3, but now here they are. Because for me, celebration is a big part of healing. And I also wonder, let's say a person has been admitted to a psychiatric institute. When they go back home, is there a way that they're received back home now? Because they've gone through something traumatic. Do they just come back home and it's the same as usual? Are we actually creating space for the family to receive them anew, right? And to ask for now that whatever has happened when they were in hospital sticks and stays. Whatever you learned, let's celebrate you. Well done. You were brave enough to go and do that. Now you're back in community. How are we integrating that? When we look at Indigenous society, for instance, when people going to war, when they came back, there was a ritual for them. They would stay out of the community before that rite of passage is done. Then they will only be allowed to come back when they've softened, when they've gone through that rite of passage. So we should also be doing the same with people. So we always end off in celebration. So we start with healing the ancestry, we heal the person, we speak to the person and ask for a change in behavior and guide them through a change in behavior. We invite what is good, and then we end off with celebration.
Oh, very interesting, very interesting. And it is a whole process of healing that starts from, from the beginning. And you also have a responsibility, I think, as a human being to also be part of your own healing process. And I like the celebratory part because it now includes your family, your friends, to say that you have gone through this treatment process. Let us celebrate, let us rejoice in the sense that you have taken this path into healing. And Dr. Kagiswa has his hand up. Interesting.
Yeah, very, very interesting. It's almost as if Kaz is saying that once I've discharged patients, I must set an appointment after 2 weeks with the whole family and say, how have you received the patient? And is everything fine?
That's a good idea.
I actually think that's a great intervention idea. Thank you very much for that. I'll steal it. But the other thing I wanted to ask Taz is the struggle that we have as psychiatrists is that whenever we want someone to come in to see us, immediately they start thinking that I want to send them to Westkoppies or Sterkfontein or Valkenburg. They don't think that I can manage them at a clinic level or a district hospital level. They feel that immediately as they come in, they're going to go further on to an asylum, so to speak, and that's why they don't come. Do you find that patients, when we talk about traditional healers, everybody thinks, oh God, I'm going to be there for 6 months and may never come out. Whereas there are some interventions that you can do that don't require a camp, like Professor Lynch was alluding to in Uganda or Nigeria. Thanks.
Yeah, you're right. Yeah. A lot of people, when they make an appointment with me, they're very anxious. And part of my work is, I don't want to say correcting work that other people have done, but it's also to deal with the trauma that people have experienced from people like me as well, because sometimes we do tend to be a bit harsh. So I am very, very super deliberate about how I make people feel comfortable, and I don't evoke, I have a conversation, right? So that we understand each other. The people that need to stay with healers are people that undergo initiation. Otherwise, there's no need for you to stay with the healer. You can go back home and you can do it. And I find that, and I do not agree with this, that there's one form of initiation where a person has to go stay with a person. There are different ways that we can do it. I think we're being called to create a new world. We live in a different world, and there's different ways that we can actually bring in our awakening to people. So I find that a lot of people are very, very anxious initially when I see them. And I think what is also helping people is we're trying to make ourselves accessible as well on social media so that people see us doing normal things. Like for me, my favorite thing to do is studying with my son and helping with his schoolwork and DACO. So if I can do those normal things, then people are like less scared, like, because my life is not all about, oh, let's divine. There's so much more that we can do as people. Yeah.
And before we even go to Prof. Lynch, there's something interesting that you both mentioned, right? In my experience at SADAG, a lot of people would be like, I'm scared of going to a traditional healer because I'll be told that I have to be Isangoma and I would have to put in Twase, so that I can go through this whole process and I would stay with this person for 6 months. I would go underwater. That is the same thing that Dr. Kagisho is saying, that they don't believe that I could actually treat them in a clinical setting, that they would have to go to Vescopies and some of the other psychiatric hospitals. It is not always the case that you would have to be admitted either to Uktwasa, Norma, for you to be part of or go to a psychiatric hospital. So that is very interesting. And I had to highlight the fact that it is not always the case. You can visit a Sangoma, you can visit a psychologist or a psychiatrist without having to move on to the next phase of it. Prof?
Yeah, I just wanted to add to that, really. I mean, it's quite similar in a way. I remember when I was working as a clinical psychologist, you know, it's often a huge step. The biggest step is often for people to come in through the front door, you know, and actually consult and get over the stigma of seeing a psychologist. And I was really interested to hear Taz's thoughts on this because, you know, I think half the battle is reducing the stigma associated with getting healing, you know, and sometimes I think the challenge with healing is that it's going to require a change. You know, something has to change, either in the way in which you're going about things or the way in which you're working with your family or your partner. And that change opens up the possibility of healing. So, you know, I think it's really important that we're having conversations like we are today about mental health, about traditional healing, and about the commonalities, creating greater public awareness about what it takes to get help, because help is out there and people often just need to reach out. I'm afraid I have to leave now to join another meeting, but it's been so good to be part of this panel, and thank you so much, Kagisho and Taz, for this really wonderful conversation. I'm sorry to have to leave, but thank you so much.
Thank you so much, Prof. It has been lovely having you. Thank you.
All the best. Take care. Bye.
Thanks. And moving on, and it's not even moving on, it's coming back to you, Taz. I would like to know, what are some of the myths that you have heard of when speaking to people with regards to mental health treatment from a traditional healer?
I think the first thing that people sometimes want to run to is the idea of witchcraft and not taking personal responsibility for the choices that they've also made. So we always need to hold people responsible for what they've done, and for people to do therapy work. I always find that is very important for any healing, that there's integration after. So I work with people, especially who are outside of South Africa, especially in Europe and in the US, who don't have access to us and who don't have access to the knowledge on the land, in the soil, who can't feel the air and all of that, because they struggle a lot from displacement. Just the idea that you're not close to home, you're not close to knowledge. And every 2 weeks we'll have sessions just to also bring in that grounding. So another thing is, and I think also as healers, we drive this point, which is unfair, that if you're not feeling well and you come to a healer, you need to twasa. And I think for me, there's a business somewhere there. It's got nothing to do with spirituality, that people also should have discernment around, no, what am I actually feeling? What this person's saying, is it resonating? And when they're with us, if they feel like, ooh, something is off, then they should immediately move away. You are allowed to do that. And also with healers, nobody should heal you from a space of fear. It should be from a space of love, from a space of comfort, because that's when true healing, that's lasting, actually happens. Yeah.
Perfect. And to the both of you, do you believe that we tackled issues of stigma in South Africa enough currently? And what more can we do as community members to help break mental health stigma? I mean, for example, there was a case, this horrific tragedy that took place in Soweto a few months ago, and I'm not sure if you guys have heard of it, where an elderly lady with schizophrenia was accused of witchcraft and was literally beaten and killed by the community because of this conspiracy. And then there was another recent case in Eastern Cape where there was this other person who was diagnosed with dementia, and their family had to take this person away because they were scared that the community would accuse her of witchcraft and actually say that they have been bewitched, or that they are practicing witchcraft.
Yes. Okay. Yeah. I think. Yeah, stigma has been there for quite a long time, and I think much like the vaccine hesitancy, you may find that the bedrock is that of fake news and misconceptions of mental illness and illness in general, and these have been going on for many years. But if we as Western medicine practitioners remain in our ivory towers in only certain parts of the community, then this will never change. So in my district, I'm advocating to move the clinics as close as possible to new settlements, so that they don't feel that they have to travel 3 taxis to come to Joburg CBD in order to access Western medicine. I think the sooner that we sort of move Western medicine into the community, the better. And then there, we can start the process of educating the community. And one way of doing that is to go through the school system, for example. I mean, these adults live with kids. They hardly ever live on their own. And hopefully one can, once you target the school kids, the teenagers, and tell them about mental illness, perhaps through that conduit, then they'll be able to say to the other parents that, no, Google is not witchcraft. I've been told about this. This could be bipolar, this could be depression, this could be psychosis. I think they must take Google to a clinic. So that's one way of doing it. So we need to find different ways in order to pass through that information to the community, and hopefully that will change conceptions.
And the key here is mental health education. Let us talk about mental health. Let us educate others about mental health. And that is one way in which we can break the stigma. Tez?
I think for me, it's about in what communities is that happening? Because for me, mental health is all encompassing. What kind of environments are people living in? Do they have trees? Do they have grass? Do they have land where they can actually be grounded, right? So if we're living like chickens all cooked up, right? It also just doesn't give us room to have that humanity. Like, it does not make sense that you're going to beat up an old woman, right? From a humanity perspective. So we must understand that what we're dealing is with people who've had adverse childhood experiences. Their development has been disrupted. So now we've got all these social, cognitive, emotional problems that are coming up, right? Like, I just think of, let's say people are not inflicting pain on other people, right? They're inflicting pain on themselves, like with the train surfing, with alive. They want to feel alive. So what can we do within that environment for people to feel alive? We can't make them live in spaces that don't honor their humanity and think that they're going to be mentally, emotionally okay as well. So what are we doing? Why do we die earlier in those environments? What is happening? So if you're inflicting pain on another person, you're going to inflict pain on yourself again, right? So then it just becomes this circle of pain in our environments. Let's give people land. Let's give people spaces just to be human as well.
You are mentioning a very important point, but it's a very tricky point in a sense that how do I say that to a person who is in Soweto and living in shacks, and there isn't land, there isn't trees, it's just corrugated iron all over. Of course, those people think to a certain extent where mental health is concerned. And it's really, really, really difficult to say that, yes, let's give people land. Yes, let's give people air to breathe. Let us give people the life that each and every person deserves to live in a dignified manner. But we are so, so far from that right now. That is the reality of the situation. And Dr. Kagisho, we have spoken to Tez about painting us an idea and a picture of the treatment.
Should have a nurse, should have a doctor who comes in now and then, and maybe even a psychologist in that clinic. I think we need to move away from undermining the clinics, the local clinics, and thinking that I have to travel all the way to Joburg CBD to get help. what's supposed to happen through managers like myself, we're supposed to allocate doctors to those clinics. Now, the doctor may not be a psychiatrist. It could be a medical officers, but through training, we've enabled them to detect distress, make a diagnosis, and at least give first-line medication, which any doctor is able to do that. So even the GP can do that. So they can access that first, and then if that doesn't work, then they can be there. Then we can escalate the service through to a psychiatrist. So I think we need to move away, and I'm trying to move away from people thinking that only a psychiatrist can help you. GPs, medical officers, counselors, social workers, they can also help you in terms of at least ameliorating the distress. Obviously, if you can't sleep, you're fatigued, you're suicidal, then you have to come to me, then I can give you medication. But in any case, you still have to go back to the local clinic to continue receiving your medication. Thank you.
Lovely. And I think you guys just keep complimenting each other in the things that you're saying, in the sense that really this treatment thing, mental health and the treatment of it, is not just looking at only a psychiatrist, only a psychologist, only a traditional healer, and that we can really encompass all of this. Where to from here, guys? Where to from here, in a sense that where do you see, or where would you like to see mental health care in the next 12 months, 5 years, or 10 years from now? How do you imagine it to be, and how would you like to see it?
For me, I think our ancestors' wildest dreams, because we've got access to so much. We can fly to places they couldn't fly to. We can travel to spaces. We associate with a lot of different people. Why would you limit yourself to one thing? As a person, we've got access to all these things. I would love to see more integrated ways of healing, and also finding ways that where you can catch a person as a practitioner, you pass them on to the other person, and that we never leave people with no spaces to go to. And also taking into account that there's many things that are happening around us, especially if you're on social media, you'll see there's this beautiful healing circles that actually where we find spaces, a person like me and Dr. Kahisho as well, that we can hold space for people together without the confines of the office as well. Yeah. So I think we are our ancestors' wildest dreams. Let's make use of everything that's at our disposal for our health.
We are our ancestors' wildest dreams. Guys, let us free our minds, let us liberate our minds, and let us reach to the sky in terms of what we do for ourselves, what we do for the people that we love. And that will, I think, eventually help us in terms of mental health, right? But we can do things that they were not able to do. Let us take advantage of that. Dr. Kahisho.
Thank you very much. I think the issue that I want to raise going forward is that people should accept that this is a stressful world. Even before COVID, it's a very stressful world, and it is constantly stressful. I think I didn't live 200 years ago, but you only become stressed when you go out hunting. You get what you get and you come back. That's it. The next month is happy days, but not now. There's traffic. There's your boss on your back, deadlines. There's school fees to be paid. There's homework to be done. So we're living in a very stressful world. We all need help. Tess was saying that some of his overseas clients are calling her every 2 weeks because they know they need help. It's not a once-off process. The same thing with us as well. People should be able to exercise on a regular basis, because we need a psychological crutch. It doesn't make you weak. I think that's another thing that people must understand. I've seen patients, when they come to me and say, I'm depressed, and I say, why? And they said, I had a fender bender, for example, a small accident, but it gave them such a fear or such a fright, they develop PTSD or not, or depression. So I have to heal them. So I think we need to understand that and accept that the stressful world and any stress in that world can lead to psychological distress, and people should be able to sort of exercise so that we can help them. Because if you ignore that, then a year later, then you're really going to come with major depressive disorder with psychosis. And then at that point, I really have to admit you. So we'll try to seek help as soon as possible.
Dr. Kakrisho, we have to accept that this world is stressful. I have never heard of that one before. We have to accept, and as you're saying, I'm realizing that yes, there are bosses that are demanding. Yes, we have got family members that need us. Yes, we have got traffic. Yes, we've got school. We've got this. We've got that. And we have to actually accept it, come into realization of that, so that we can be able to implement things that will make this stress better for us to manage and better for us to handle. That is very important. And as a closing statement to the both of you, can you please tell the audience, why is mental health important to you? And why is it important for the audience to take care of their mental health? Taz?
Mental health is very important because we are so interconnected with each other. We know that with Ubuntu, if I'm not well, then the next person is also not going to be well. Mental health for me is important because, you know, where we find ourselves, especially with, let's say, violence against the divine feminine as well, right? We also need to take care of our men so that our women can be well. We need to take care of our women so that our men can be well. So it is that interconnectedness that we have in the realm that we can see and in the realm that is unseen. So for me, for everything to tick along well, for everything to be connected, for everybody to be well, I need to be well. If I am healed, I become a better healer. If you are healed, then you also can serve the world in a better place. So because we are interconnected, we actually have no choice but to do the higher order work so that we can be healed for each other.
And you cannot pour from an empty cup. You cannot pour from an empty cup. Doctor?
Yes, thank you, ma'am. I think, to be crude, mental health is money, if I could be crude. Because if I'm mentally disturbed, there's no way I'm going to work. You know, a lot of people, they go to work, you know, they've got some depression, some anxiety, but they're just not as productive as before. And these people are at the risk of getting fired, and which is what we've seen. Then people get referred to employee wellness programs, you know, and immediately when you're there, you can imagine that you're about to be fired. What should people be doing instead? They should be seeking help. With the fact that they're depressed, the fact that they're almost psychotic, the fact that they're anxious is affecting their production levels. And I think we need to accept that part. I mean, even with myself, once I get to a point where I feel like, you know, I'm boiling over, I would take a break because obviously it starts impacting on my work. But also socially as well, you're going to lose a lot of meaningful relationships. You're going to lose a chance of marriage, you know, a chance of good parenting because you're mentally distressed. So I think we need to not look at it as a fancy state of existence, but it does have practical implications why you need to be mentally well.
Not taking care of your mental health will cost you money. I'm saying that in bold. In my head, it's in bold. It will cost you money. And I think that is enough motivation for people to start now taking care of their mental health. Thank you so much, Taz. Thank you so much, Kakriso. It has been a pleasure talking to you. And it has been a pleasure, and I've learned so much. I'm now going to hand over to my colleague, Casey Chambers, who's going to be taking a few questions from the audience.
Thank you so much to the fantastic panelists. I mean, what a great way to have this discussion. This is the kind of conversation that can go for hours, and I loved all the questions in the chat box, and to all the panelists for your time this morning. I think this is a start of a series, and I'd love to challenge everyone to join us in ongoing sessions as well. We'd love to organize some more because so much has to be unpacked, and having these safe spaces to talk about it, I think, is really helpful, and to integrate what mental health care should look like in South Africa. Thank you so much to everyone who has posted questions. We're taking all of them. We're going to be putting a Q&A answer fact sheet together, which we will send to everyone. But we have been recording, and we will share the recording in the next 24 hours, and you're welcome to share it and make it go public. And we encourage you to have these kinds of conversations in the spaces that you're in, with the people that you work with and engage with on a daily basis. Mental health should not just be celebrated or commemorated on World Mental Health Day or October as Mental Health Awareness Month, but every day should be Mental Health Day, where we're talking about these important topics. I'd like to also just invite everyone, SADAG is hosting another online Facebook Live this coming Friday, where we're really going to be unpacking community mental health services, which has been raised this morning. I'm really looking at how to access help from clinics, support groups, and really just unpacking that a lot more so that we can encourage and break down those barriers to care. So please do follow us on our Facebook page for our discussion on Friday between 1 and 2 o'clock. We'll be posting the handle in the chat box. Everyone for your time, thank you so much. And to Zenzekile and our fantastic panelists, thank you so much for your insight and your passion as we all take a little bit today and feel more inspired as we work together. I really appreciate everyone also wanting to network. We do have your contact details and we will be engaging. Yes, we do want more support groups. We want more networking, more opportunities to network, and even regional teams. So we take your suggestions and we'll be brainstorming and reaching out to everyone. Thank you so much for everyone's time. Have a wonderful day and see you soon.
Thank you and bye-bye.